first thing they had to do was to fashion a stomach bag for me. So hata my mom akawa worried, the whole family was worried. And sasa tulijua tu cancer is a death sentence because my dad had just passed on. After cancer treatments, mwili yako ni kitu ina change kabisa. You can never be the same. So for me, nilikuwa na shida ya kupass long call, ya kupass urine. Saizi I have a condition which is called acute cystitis, whereby I normally lose a lot of blood when I'm urinating. And apart from that, I tend to block a lot because napata blockage na blood clots kwa bladder. Then bladder yangu pia ilikuwa perforated. So because of radiation, it was so tough. And my bones became so weak, so I'm ever on supplements. Memory loss is one thing that have really hit me. Naizambiwa kitu na nikasahau. The other thing is my reproductive system ilikuwa affected, though I was cancelled before, because you can no longer give birth unless ufanye IVF, because radiation huwa imeharibu your reproductive system. Sai I'm cancer free, but with cancer journey it can reoccur.
Welcome back. Now, one of the concerns that comes obviously with this diagnosis is cost. One of the questions we have here says, from this, everyone wants to know their health status, but they fear the cost of consultation of the doctor and where can they get affordable treatment. So we would like to tell you that these treatments are available next to you. The county hospitals next to you, the mission hospitals next to you can do this test and can make this diagnosis. You do not have to come to Nairobi or any, of the more expensive hospitals. And our sponsors, CIC, are here to give you options, insurance covers that would make sure that as you go through this journey, you're fully covered and not paying out of pocket. Now, Dr. Carey, we've talked about treatment. What are some of the treatment options that are available for this cancer? Can it be cured completely? And what are some of the things that come as a result of complications from this treatment?
So as Martha has said, she's cancer-free. Colon cancer is curable. And it is, the chances of a total cure are higher with an early diagnosis. So when you come to hospital when you have no symptom and it is a screening test, one of the treatment modalities may involve surgery. Very early colon cancer does not even require for us to do anything else after the surgery. Because, it's very early, they don't require, chemotherapy or anything else. When it's a little more advanced, like Martha's case at stage 3, meaning that she had a large tumor, it had caused blockage, and that's why she was trying frequently to use, laxatives. And of course, depending on where the cancer is, if it's a little lower in the gut, near the rectum and anus, sometimes we have to fashion a stoma. Because if we do surgery, they'll have incontinence. So we fashion a stoma like the one we've been shown. So a stoma is something many people actually live with very well. It just means that the stool is diverted and it goes to a bag. And that bag has a little zipper which you can open and empty and close it again. And every 3 days probably change the bag. And there are many people who live with a stoma, you can't tell, and they live a good quality of life.
Doctor, I'll ask for a quick minute so we can speak to Claudia. Hello, Claudia. Claudia. Okay, fine. Claudia will get back to us. Yes, Daktari.
Yes, so the surgical means are to remove the tumor and join together without a stoma, but some patients need a stoma. Now, the surgery also for early cancer can be done laparoscopically. That means through a camera, you don't need to be cut. But for the bigger tumors, sometimes open surgery is usually preferred. Then the other treatment modality is after we've done surgery, if we think that there is some little disease left, we want to give you chemotherapy to wipe off and reduce a recurrence. Now, sometimes if you've presented with what we call stage 4 disease, meaning it has spread to the lung or to the liver, we also give chemotherapy to shrink it fast before we go for surgery. I must say, Dr. Lauren, that colon cancer was one of the first cancers where what we call metastectomies were done to cure people with stage 4 disease. So sometimes we give chemotherapy, then after chemotherapy we remove the cancer in the colon and we remove the metastatic lesions if they're in the liver or the lung. We also use other methods like radiotherapy using CyberKnife or radiofrequency ablation to burn out the metastatic lesions and either cure the patient or give them a long time before the disease comes back.
So I think the greatest thing you have told us is this cancer is curable.
Yes.
And one of the critical things we need to do is find it early. Yani hii cancer ikipatikana kwa mapema. Saratani hii inatiba na inaweza tibiwa kwa ukamilifu kabisa. We have a question of someone is asking, I have a male child who's 13 years and has been complaining of stomach pain. So they did an endoscopy and an x-ray, they found fecal impaction. Fecal impaction inamaanisha choo ambayo imejaa kwa njia ya tumbo. Now it was managed in hospital and the patient was discharged, but he is still getting pain, persistent nausea and headaches. Do they have to be worried? So in a younger child, this one is 13, what are the concerns? And I'm curious to know, what is the youngest patient you have had with this cancer?
Daktari, there are documentation of patients as young as 17 having some types of colon cancer, but that is an outlier. They say that Africans tend to have colon cancer a decade earlier than whites, meaning probably our genetic predisposition is a little different. I have many patients in their 20s and in their 30s, which is a little different than what is written in the textbooks about the age of presentation. So, but 13, for this patient, I'd probably worry about other things causing the fecal impaction. Is it the child's diet? Is it other drugs that the child is being given that are causing extreme constipation? Is it an infection that is causing that? Sometimes in younger patients, we find that worms can cause a bit of obstruction in the gut. Now, if the mom is not happy and the child is still unwell, it's very important to go back to hospital, get a CT scan, a good examination, and probably even another scope. Is what I would advise mom to do, to take the 13-year-old boy back to hospital.
Okay. There is a question asking if there is any relationship between anal sex and cancer.
Also a good question in that anything that can cause inflammation or irritation to the gut. You know, I'd talked about the fact that constipation, stool remaining in the gut can cause inflammation and therefore high risk of cancer. And so can be said about anal sex because it causes inflammation and irritation of the gut. This inflammation can lead to what we call squamous cell carcinomas of the lower part of the gut. So commonly with that irritation, the type that we see as squamous cell carcinomas.
Okay, so Stephen from Kirinyaga County is asking, kuna uhusiano wote kati ya H. pylori na colon cancer? And we lose a lot of time in this H. pylori diagnosis cycle. So I would like your comment on that and also just a comment on what is the take-home message? What do you want to say as an oncologist from the cases you've seen? What is your closing comment on this? So
H. pylori is a bacteria found mostly in the area of the upper gut. And probably the association of H. pylori would be with more of gastric or stomach malignancies and a little less with colon cancers. And I think, Daktari, our take-home message is very clear, is that our discussion today is about colon cancer. It's a very common cancer in our country and in the region and in the world. It can easily be diagnosed very early by screening. And screening means don't wait for symptoms, go for an annual check. 2, having colon cancer in the family is a strong indicator that it's very important to go for an early colonoscopy if you have a relative who had colon cancer. Now, when it's diagnosed early, it's very, very curable. Now, just to give support to those who need a stoma, some of the stomas that are done when colon cancer is diagnosed are reversible. That means that we do a stoma, we treat you, we give you chemotherapy, and when we finish, we close the stoma and you can pass stool the normal way. So there are some that are reversible, there are some that are irreversible. Some of the symptoms that Martha is talking about are from radiation, and they shall come to an end. Because she had a low-lying cancer, that's why she has a stoma. That's why she got radiotherapy. Radiotherapy is not given to all colon cancers. And because of the radiation, she has a bit of irritation of the bladder and some of the symptoms she's talking about. So those will come to pass. And we wish Martha all the best.
Thank you so much, Dr. Carey, for joining us and for the wonderful insights that you have shared. Now, we have one other question on SMS. Okay, hello Daktari. My brother has colon cancer stage 4 and has a lot of bleeding, more especially when going for a long call. What is your advice? So I think we have just 15 seconds to respond to this one as we close.
All right, very sorry about your brother. You haven't, okay, we would imagine that of course he has had a colonoscopy, and some of the ways we use to stop bleeding is that if it's very low, like rectal or anal, we do radiotherapy to stop the bleeding. If it's a little up, we tend to want to do surgery to remove the bleeding part, and then later we can do chemotherapy.
Asante. Tunashukuru sana. Thank you so much for tuning in. Please continue sending in your comments and thoughts, and we look forward to seeing you again next Sunday at 8 p.m. on Citizen.
There is life after diagnosis. There is life after cancer. And I'm just trying my best to keep hope alive.
Uliza Daktari, brought to you by CIC Insurance Group.
Keep your family protected with our Family Medisure cover at an affordable rate. Our Seniors Golden Age cover is now more comfortable with Seniors Mediplan cover. And for 4 or more members and their families, Corp Care has you covered. CIC Insurance Group. We keep our word.